Yeah, I suppose let's chat lymphedema. I mean, what is your how long have you been involved in lymph therapy?
So I finished my training in 2010, and I started working at a practice in Joburg in 2012 that was involved with lymphedema. I'm sure you'll know the name Alison Dendy. So I started my initial career there, and she did a lot of lymphedema work. And then a couple of years later, I went into my own practice, and then I just kind of carried on. I actually never did any other physio work. I've only been doing lymphedema for the past, I don't know, I don't want to count how many years.
Okay.
Too long.
We're going to give away your age
Yes.
then.
No. I'm not going to tell you. Long enough.
Yes. Okay. And I mean, just in your general experience, have you seen a need for lymph therapy growing? Have you seen, more and more patients? Is it becoming more prevalent, or is the education just better around lymphedema?
I think that's exactly. I don't think there's more lymphedema patients than there were in the past. I think they were always there. I just think they were never diagnosed. And I think the major problem, and I always explain this to people, is there were very few lymphedema therapists in South Africa before 2015. It was only if you wanted to become a lymphedema therapist before 2015, you had to do your training overseas, which means 3 weeks out of your practice, a hell of a lot of money, and very few therapists could actually afford to do that. So we just didn't have therapists. And then in 2015, Lymph Education Africa, Susie Davey, they started doing training in South Africa.
Okay.
And then from there on, there was a lot more. And then another lymphedema school started doing training. So there's a lot more education in terms of therapists, and a lot more therapists around. And I think the word is starting to spread to the doctors to actually refer to the therapist.
Okay.
I think that's why we might be seeing a rise in the number of lymphedema patients. I think they've always been there.
Okay.
And I think people are just a little bit more open to, to these kind of treatments and therapies that in the past, they just said, well, sorry, there's nothing we can do for you.
Yeah.
I think that's the main reason.
Okay. So in terms of diagnosis, who would invariably do the initial diagnosis?
So it depends. So we often get the patients that we see them first. Well, it depends on which channel they get to us. But if it's cancer related, the oncologist or the surgeon, depending on who the patient's seeing at that point, would notice the edema and say, okay, you need to see a lymphedema therapist. But very often they start Googling, and then they start, they find therapists. And then we are the ones, the lymphedema therapists are the one actually making the diagnosis. Okay. In terms of official diagnosis, scans and those type of things, it is out there. There's a few tests that you can do. There's no blood test. It's a lymphoscintigraphy that we used to do in the past that a lot of the hospitals can do to diagnose lymphedema. But it's actually if you see a patient with lymphedema, it's self-explanatory. It's chronic swelling that has been there with pitting edema. If you can go for a scan, but it's not really going to change your treatment outcomes.
Okay. Yeah. So, I mean, with us as Anita being in the lymph sphere, I mean, we only really deal with the management side of lymphedema. So obviously a therapist like yourself, you'd bring it under control, and then a product like ourselves would be used for long-term management. So just basically take me through the difference between like the treatment as opposed to the management. I mean, just for the people who are watching this.
So you mean in terms of how do you treat? I think one of the questions that you sent through on the email also, what's the difference between treatment and management?
Yes.
So yes, in terms of that, so lymphedema can be managed. It can't be cured. Let's just get that out there. But the earlier you catch the lymphedema, the more manageable it is, and at some point, maybe sometimes reversible, but then it needs to be caught really early and diagnosed really early. Okay. So the treatment of lymphedema involves, in terms of therapy, we talk about complete decongestive therapy, CDT in short, where we do manual lymph drainage, compression bandages if necessary, exercises, advice regarding skincare. All of that is involved in complete decongestive therapy. So, and how that works is we generally, my protocol, my practice specifically, just because we believe in high intensity treatment for long-term control, because the more you treat in the beginning, the better your control in the long term is. So we would see, for example, a patient in the first consultation, do the MLD, which is the manual lymph drainage. It's a very soft massaging technique. It's not painful. It's literally just stimulating the lymphatic system to reabsorb the fluid. And then we will, if necessary, put the patient in compression bandages. They wear those bandages for 24 hours. They come back into the practice and the process starts again. In the 24 hours, they're given exercises that they need to do, and they need to drink water. So we talk about a little bit about diets and water intake, etc. And then we continue like that until the limb, if it's an arm or leg, or even if it's chest swelling, like in your case, I think the Anita Brass, I think you guys see that a little bit more, until we see the swelling, there's no pitting edema, meaning that if you put the finger into the limb, it doesn't push away and stay there. The pitting edema has gone, meaning the protein molecules have mostly moved into the lymphatic system to be reabsorbed. When we get to that point, then we can go and say, now we can fit you into a compression sleeve or into a compression bra or whatever is needed at that point. And that is then the long-term management. In terms of further management, surgical management, it is available. South Africa is slowly getting on board, and we do have quite a few surgeons or a couple of surgeons, two that I'm aware of, that is actually doing lymphedema surgery, one in Cape Town and one in Joburg. And it is successful, but it's not the first line option because most of the medical aids don't pay for it. So it's for a very selective few patients that can afford it. And if they can get it through the medical aid, it's not all medical aid. So unfortunately, the surgical option is still limited in South Africa.
Yeah. So, I mean, in your experience in the therapy, with it not being a curable disease, or condition, is it? I know a lot of people think it's something you get if you've had breast cancer, but that's not the case, is it? I mean, it's any kind of damage to your lymph nodes.
Absolutely. So I always try to explain to patients just so they understand where it comes from. Lymphedema comes from two places. It's either a primary lymphedema, where you have a malformation in your lymphatic system that can present anytime from birth to age of 40, 50, 60, where it can still be a genetic problem. So your lymphatic system is not functioning and you develop primary lymphedema. We don't see that very often. We do see it, but it's not as common as our secondary group of lymphedema patients. So the secondary lymphedema patients, that's our cancer-related patients most commonly, but it can also be due to venous insufficiency. It can be due to trauma. There's a lot of things that can trigger lymphedema. It can be lymphedema after a patient has been diagnosed with lipedema. There's a lot of other secondary reasons that lymphedema develops. So I think, it's definitely not just cancer. I think it's just more well known in the cancer world because that's where the referrals normally comes from. And the doctors that are actually doing the surgeries and in oncology treatment, they are aware of it. So they are actually a little bit more wide awake in terms of the management of lymphedema, where the rest of the world and is not necessarily, they don't necessarily realize that it is lymphedema. And that's why it's just not referred.
So if a patient goes for a mastectomy, for example, and she has lymph nodes removed, does that mean she will develop lymphedema, or will it lie dormant?
No.
Is it like a ticking time bomb that could develop? Or is it guaranteed that if you have a lymph node removed, you will develop lymphedema?
So, not at all. So your lymphatic system is actually a very clever system. So once there's damage or trauma to your lymphatic system, what happens is you develop accessory pathways, and those accessory pathways can sometimes be enough for the patient to reabsorb the fluid that your body is producing every day. But in some cases, we get patients where they have removed 20 lymph nodes and they never develop lymphedema. And in other cases, you get a patient with one sentinel lymph node biopsy that's been done and they develop lymphedema. So there's absolutely no guarantee that you will or you won't get it. You can't say whether you will be lucky or unlucky. There are factors, though, that contribute to it. So if the patient do have lymph nodes removed after a mastectomy, and they go for radiation, definitely that adds to it, and their chances of developing edema afterwards is definitely bigger because of the scarring. Obesity plays a bit of a role. The amount that the patient is doing with that arm, also, you know, the stage of the cancer and how progressive it was, and how much they had to search for the lymph nodes during surgery, how the surgical cut was done. There's so many factors involved and I think that's why we can't say you will or you won't develop lymphedema. And I also think that's often why it's not mentioned to patients before they have the mastectomy surgeries. They often fail to talk about lymphedema before. And I think that's the reason, because they can't say you will or you won't. It's just something that some people get and some people don't.
Okay. I know I've had some of the literature I've read as well. It tells you things to avoid doing if you've had any kind of lymph damage or lymph node removal. Things like for example, if it's on your left side, try and avoid wearing any kind of tight rings. If you get any kind of abrasion, even if you get like a really bad cut on that side, even something like sunburn can trigger lymphedema. I mean, is that quite an accurate?
Absolutely.
Are those accurate triggers?
Absolutely. Absolutely. I was actually at a conference last year in Copenhagen in Denmark at the 10th International Lymphedema Conference. And this was one of the big topics that a lot of people were talking about, because for so many years we've been saying to patients, you know, you shouldn't do this and you shouldn't do that when you have a possibility of lymphedema. And some of them are correct. So, but a lot of those things doesn't have any research background to it. So, you know, we've often told patients you're not allowed to wear a ring, and you don't do this, and don't lie in the sun forever. And we need to also move away from that train of thoughts and say to the patients, relax about your arm. If it's going to happen, it's going to happen. Just look after it. So instead of saying, you know, don't all the don'ts, rather say do's. Rather tell them, do exercise with your arm, look after it. Don't do pesticides and sunburn, because that all triggers inflammation. So again, I think it all comes back to educating these patients properly and saying, you've got a compromised lymphatic system. They removed lymph nodes. You just need to protect your arm. So anything that can possibly trigger inflammation, which will cause an increase in lymphatic fluid, or toxins like mosquito repellent, or those type of things. Try and avoid those.
Sure.
Yeah, because again, remember, your skin is your biggest organ, and everything that is absorbed through your skin goes directly into the lymphatic system. So you wouldn't want to, or perfumes or those type of things. But again, I can't say this with research background. It's just logically telling the patient, look after your arm, but don't stop using it. Because on the other end, we've often seen patients coming in after 2 or 3 years after having mastectomy, and they just don't move their arm. They're just so scared to do anything with it that is also detrimental. You know, that arm actually needs exercise. It just needs the right type of exercise and the right amounts. So we just need to be careful of all the don'ts, and to say to patients, stop doing anything with that affected arm. Instead saying, you can do all of this, just be careful. And then just teaching them and educating them on signs and symptoms of lymphedema. Say, if you feel any heaviness or tightness, or if you feel your ring or your watch is a little bit tighter than it usually is, then contact a lymphedema therapist.
And do you think there's enough education out there?
Not at all. Not at all.
And
that's absolutely a worldwide problem. What would I change?
In terms of how
I would start at the varsities. If I had a say in it, I get very passionate about this, I would start at university level, because nothing is taught at university level about the lymphatic system.
Are you talking?
They are not teaching our medical doctors about lymphatic system.
Oh, so you're talking
the whole
medical level?
Allied health, everybody. Allied health GPs, doctors, specialists, they're not, maybe the specialists at some point, you know, get to do with the lymphatic system. But if you speak to a GP, the GP that we work with closely, we had a conversation with them the other day, and even they said, they taught us nothing about the lymphatic system. You know about it, you know what it does, but they don't teach you anything more than that. And they're not aware of the therapy that's out there. And I think that is our biggest concern and issue in South Africa, is that we don't get the patients, we don't get to treat them, because they don't get to us. They don't get to the lymphedema therapist. If they don't start looking on the internet and, you know, looking it up themselves, their GP is probably just going to give them water tablets. So while your leg is swollen, there's not really much we can do about it, or just put them in compression, which is also not the right way to go. We first need treatment before we do compression. So I definitely think it needs to start a little bit, back at the lower levels of education already, and then we need to go to the GPs and the doctors that's out there already to say that there is treatment available for lymphedema. And it doesn't mean that the patient's leg have to be this big before you send them for education after they had trauma, or even the slightest swelling that's persistent knee swelling after total knee replacements. Those patients still struggle with chronic edema, and chronic edema is lymphedema. So I think it's a whole mind switch that needs to happen in the medical world, that we don't only need to treat a patient with an arm or a leg that's this big. We actually need to prevent them to get that big, because we also don't want to see the arms and the legs that's that big.
Yeah, sure. You don't want to, you want to get absolutely, you want to get the patient where it's still manageable, or
we can still reverse it and have easier compression, and we don't have to wear that heavy compression, but you get to a point where you don't have a choice.
And I also think there's a huge amount of I mean, I see it with, and I'm like putting this out glibly, for example, somebody who's gaining weight, they tend to learn how to live with it, and they don't address the problem. And then before you know it, you've suddenly like, oh, hang on a minute, I've gone up 6 cup size or 6 pant sizes. When did this happen? And do you find a lot of patients also, they just think they're going to ignore it. They're going to go like, oh, hang on a minute. Or suddenly this is now out of control. I'm losing use of my limb.
Absolutely.
And I mean, why would, in your experience, why would a patient allow it to get to that point?
Because especially with primary lymphedema patients, it's not painful. They don't have pain. They've got a little bit of discomfort maybe, or a heavy leg or a heavy arm and the secondary edemas, but it's not necessarily painful. So if you can carry on with life and, my foot is a bit swollen, but you probably or might not have the money to address the problem, you're just going to leave it. And if your doctor or your whoever tells you, well, there's nothing we can do about it, we've given you water tablets, they just go, well, I've tried the tablets, it doesn't work. And they end up leaving it. But that is a major, major problem in private and in public sector. It's not just, the one or the other. Public sector, I think, definitely is worse off because they also don't have therapists. And they don't have, I don't think there's always the finances in the public sector to actually manage these conditions. But even the private sector, we've got the same concerns about, finances and the cost of lymphedema. It is unfortunately one of those things.
So, I mean, not only is it about the education of the doctors in the medical sector, it's also about educating the people who are likely to suffer from it. The public need to know.
Absolutely.
And what is
something.
So, I mean, other than groups that are out there and therapists that are working actively, what kind of access do people have to this info? I mean, Dr. Google is great, but, is there more direct?
That's the thing. No, I don't think so. So LYOSA started, which is the Lymphedema Organization of South Africa. We started in 2014. I can't remember exactly, but it's quite a couple of years ago. This organization was formed. And the whole idea of LYOSA, the Lymphedema Organization of South Africa, is to educate the public and to make sure that we are aware, or that people are aware that there is treatment available. And like I said, after 2015, when more therapists were trained, every year a new group of therapists are trained in lymphedema. I think definitely we have started strengthening as an organization to be able to educate. But again, it comes down to managing it. Myself, I'm on the exco of LYOSA. And we all do it for love and charity. There's no financial backup for it. So it's a battle because we want to do the marketing and we are running these things. But it's all, again, on a budget. And I'm not pleading poverty. That's not what I'm saying. I'm just saying it is a struggle to actually get out there and, make sure that people are aware of it. And we all still running our own practices and running our own households. And we all still have all of this going. And then we're trying the LYOSA to keep that alive. And I think this year, especially, we've been doing really well. And it is Lymphedema Awareness Week, and we've got this post going on Facebook, but it's still not enough. We're not getting out there enough because we are 5 people on the exco, and all the other therapists are working people, you know, we're all just doing our jobs and trying to help these people and trying to earn an income yourself. And, you know, so education always takes a back seat, unfortunately, but it's necessary. We really need to get that out there.
Right. And lymphedema is prevalent enough for it to require huge amounts of education. Or, I mean, how big is lymphedema? I think I read somewhere in excess of like 250 million people across the world suffer with the condition.
Yes, absolutely. So I can't give you the exact amounts. And I think just to put that in perspective for you, there's a lot of prevalence studies that's being done. So the International Lymphedema Framework, the ILF, they do prevalence study, which LAOSA actually forms part of this framework. We just haven't done any research in South Africa. COVID has definitely paused a lot of it. But they are seeing massive, massive amounts of people that are underdiagnosed worldwide in lymphedema. So even if you go and you do go look at the numbers that's out there for lymphedema patients, you will see that it is so few and far between. So you will read one study that would say the prevalence of lymphedema after breast cancer surgery is between 3 and 25%. So there's a few factors behind that. And one of them was staging. And, you know, in the beginning, lymphedema wasn't staged properly. So research wasn't done properly. And now we are at a stage where we can do research. But again, it takes time and it takes resources. And all of that will come out. But if you look at newer studies coming out, the prevalence of lymphedema worldwide is much higher than even I think the people doing the studies expected it to be.
Okay. So
it
if
really
you,
is a lot of patients.
Right. You know, I always like to wonder if is it something that you'd like to see people getting more behind? Okay, you've got all your breast cancer organizations, and you've got the pink ribbon. You've got people who are getting behind that cause. What would be your ideal situation if you could say to anyone, get behind this cause, this is why? What would you say to them?
I think I would say that there's so many people out there with chronic edema and lymphedema that's not even aware of it. And like you said before, that's just living with it. And I would, you know, if I have to speak to hospital managers and those type of people, I would really like to do more studies in South Africa to say, you have any idea how much money you're spending on cellulitis infections in hospital that can be prevented if patients are being properly treated for their lymphedema or for their chronic edema. So there's a lot of reasons why we really should be looking into this. And I think that's why the prevalence studies worldwide has started, because of the cost that chronic edema and lymphedema has led to. That can be prevented. And yes, the cost of treatment for lymphedema is expensive, but it's a lot more expensive if patients are being hospitalized. You know, if we can prevent a patient from getting into a stocking, and I'm sorry for the companies giving the stockings, but if we can prevent these patients from getting into stockings, you know, the cost of treatment will be much less. And that's for everybody across the board. So we really do need the help, not just for the patients, for the whole healthcare system. You know, the patients are also living with conditions that they don't understand, that they need to. And I saw one of your questions was social issues regarding lymphedema. You know, there's situations where, and especially in our more rural areas, where people are being just excluded out of their whole social environment because of they don't understand the condition. They end up with elephantiasis. They've got these massive limbs or legs, and they don't understand why they have it, you know. And then there's a whole theory behind it that in some of the cultures that pops up. So unfortunately, it's really all over. Absolutely, because it's not something that if it's not explained to you properly, you're not going to understand why your leg keeps swelling and swelling. No medication is helping. Nothing is helping. It's just getting bigger and bigger. Yeah. So I don't know what I can say more. But
are there any organizations that are requiring funding for this kind of stuff that you would encourage people to donate to? Any organization you'd like to see growing in terms of the education and helping the public sector in actually getting out education, helping with treatment, that kind of thing?
Absolutely. So there is the only organization that runs lymphedema or that does anything for lymphedema in South Africa is LYOSA, the Lymphedema Organization of South Africa. There recently has been a group of doctors that started, but it's a vascular group of doctors, and they do include lymphedema protocols and management and more the surgical part of it as well. So if there's funding that is available, I think the best way to utilize that is to maybe put it into research in South Africa. But because I think as soon as we've got more research, we can do better education, and from that the ball will start rolling. So if funders, would be interested in funding, I definitely think it would be via LYOSA. Also because we now have the link with the International Lymphedema Framework to do research in South Africa. And those studies will be prevalent studies. In other words, the amount of people that's struggling with lymphedema. And again, that would just go so much further if we have the financial means to actually do these studies. So I think if you are, number one, a patient looking for a therapist, on the LYOSA website, on the Lymphedema Association of South Africa, it's LAOSO, on the LYOSA webpage, there's a link that says find a therapist, and all the certified lymphedema therapists are linked on the website. So you can get their contact details, and all those therapists should be able to help you properly with complete decongestive therapy, and then refer you wherever necessary to surgeons if you're a surgical case or whatever the situation may be. So I think that's the first place where I would refer a patient to. On the website, we also have general information about lymphedema, what it is, how it's managed, which explains it very nicely. So I think that'll be great if we can draw attention to the website and just say to the people, go look and find proper information, and don't just go overseas, because we've also seen that often happen, people running overseas for therapy. We've got world-class therapy available in South Africa. We really do have fantastically trained therapists. We've got fantastically trained doctors to do surgeries now. We're really not behind the rest of the world in terms of therapy for lymphedema. And if you do have any questions regarding it, you can email info@lyosa.co.za. The information or the contact numbers or the email address is also on the website. So if people just look at that, they will get more of the information that they need.
Wonderful. Thank you so much. I mean, it's always so enlightening to chat to somebody who's at the coalface, who's getting to deal with patients, who's actually physically, treating this condition and making a difference. It's always so nice to get a nice, passionate opinion on where it is in the world. Again, if anyone's looking for that information, follow the website.
Absolutely. Thank you. Thanks, Stephen. Have a lovely day.
Go well.
Bye.
Bye.